Cancer disease is a growing health problem in Uganda and can affect any part of the body. Statistics reveal that the number of patients has been on the increase. In 2016, there was a crisis after the breakdown of the only radiotherapy machine in the country. Patients who did not have the finances to seek medical help elsewhere were left hopeless. The crisis prompted the procurement of a new machine, the Cobalt 60 radiotherapy machine.
We are introducing to our new machine, the Terabot Cobalt 60 machine, which has been installed, and we are going to officially open it on the 19th of this month, on Friday. And it's quite a new machine, as you can see it. And I'll also introduce to you to my colleague, who will also give some word as far as the technical part of the machine goes.
Thank you so much, Dr. Kanyike. My name is Dr. Kavuma Usi. This machine was installed in October, November last year, and we started treating our first patient on 4th December. So we have been treating patients for the last 1 month or so. We can use it for treating a different range of cancer patients, from cervical, breast cancer, head and neck, and so many other abdominal and the other head and neck cancer. As you are aware, a machine similar to this broke down in 2016, and it was a crisis for the country. So I'm happy to inform the public that we have restored the services. We are able to treat more patients with this newer machine. This newer machine has some few advantages over the other machine which broke down. It is more digital, more computerized, and it's faster when we are treating patients.
This radiotherapy machine has the capacity to work for 24 hours and can be used to treat patients with different kinds of cancer. The machine is able to handle both palliative care and radical cases.
This is the control area where we are standing. It's the area where we control our machine from. And our radiation therapists, those are the specialists who treat the patients on the machine, technicians, stand here and they monitor and control the treatment from this area because of the safety. And maybe to take you briefly about the area. Currently, this area was, before the machine broke down in March 2016, by the time it broke down, so we are treating about 80 patients. But because it was slower and old, those 80 patients were being treated in 24-hour period. So we were working 24 hours. We were working daytime and night in order to get that number being worked on. Currently, we are treating around we can treat up to around 120. We are currently, I think we have received around 80 patients and more. And we expect that we can be able to treat at a maximum of 120 patients within the 12 hours. So that means that we can treat even more patients in lesser time, because those are patients we can treat in 12 hours. All kinds of cancer patients can be treated on this machine, right from those who need palliative care. Palliative means that those are cancers which are so advanced and you cannot cure them. But we can help them to relieve pain, to relieve bleeding, and to make them comfortable. That means improving the quality of life to those people. So those patients in palliative form can be treated. It can also treat radical cases, all those cases who come early, and we can be able to cure those cases, can be treated on this machine. It's a common thinking in the community that cancer is not cured, but the truth is cancer can be cured as long as you seek help at early stage, especially when the cancer is still localized. And mostly when it is localized, we use local treatment. And local treatment either use radiotherapy or surgery. You can use radiotherapy with other drugs called chemotherapy or radiotherapy alone. And this is the radiotherapy service we will talk about. And currently we have only this service in this center. It's the only radiotherapy services we have in the country, and we are fortunate that now we have a new machine, a modern machine, which can treat faster, which is more accurate. So I think we encourage all patients to go for screening so that we can catch that cancer earlier and they can get their treatment in the radical form so that can be cured of their cancers.
Currently, there is only one machine in the country, but the immediate and future plans are promising.
As much as we have opened up and we have started treating our patient, of course one machine in the country is not enough. As much as you can treat 80 or 120 patients per day, the number of cancer cases are so many. About 50% of all cancer patients require radiotherapy as part of their treatment. So Uganda Cancer Institute in the process of expanding more radiotherapy. Another center, we are constructing another center up where we are constructing 6 bunkers to house many more radiotherapy machines, such that we don't have a similar crisis that we had before, where one machine breaks down and the country gets into a crisis. So we are hoping that in the near future, such crisis may not be able to repeat after the installation of 6 more machines. One of the objectives of the Uganda Cancer Institute is the expansion of radiotherapy services countrywide. There is a program to construct a radiotherapy center in Mbarara, another center in Gulu, and another center in Mbale. So all of those plans are in advanced stages. The ministry is aware, and they are trying to mobilize funds such that we help those people who are unable to come to the Kampala for such services.
Fortunately, the Cobalt 60 radiotherapy machine in the Uganda Cancer Institute at Mulago is new, modern, fast, and accurate. Though there is a lot of mystery surrounding the cancer disease, there is hope for cure only if it is detected at the early stages.
The machine can work 24 hours without any problem, but the people who work on the machine, they are human beings. For them, they are unable to work 24 hours. So for the time being, we are working for about 12 hours. We start from about 6 in the morning up to around 7. But the machine has the capacity to work for a longer period. The treatment it gives is more precise, more conformal. As you know, these days, things which are digital are more precise compared to the analog equipment that we used to have. So as you can see, this machine, everything is really computerized, which is not the same as the previous machine. So dose delivery is better. The radiation is more conformed to where you want it. The primary objective of radiotherapy is to maximize radiation to the affected area and minimize radiation to the normal tissue. So these machines can do that much, much better than the previous machine.
But what are the causes of cancer? It is caused by both environmental factors and abnormal occurrences within one's body. The signs and symptoms differ depending on the type of cancer and the body part it affects. Despite the mystery and uncertainty surrounding cancer disease, there are things that one can do to reduce the risk of getting cancer. One of them is avoiding smoking tobacco.
Generally, there's increase in the number of cases we see, and that might be coming in 2 forms. Either currently, because of the media, which has been more common, people are more informed than before, so more people seek medication and advice from hospitals. Therefore, we see a more number of cases reported or presenting in hospitals than before. So many were dying in villages without being recorded anywhere, documented. So that also contributes to the increase in the number of cancer cases we see. But all the same, still, I think there are so many environmental factors which have come around, which can be affecting the increase of cancer cases, definitely. There are so many predisposing factors like those cancers, like diseases which are associated with cancer, like HIV. If you look at the cancer of the cervix, You might find that those patients who have HIV are predisposed to developing cancer of the cervix. And so you'll see a bigger number of cancer of the cervix in such patients, and also you see young people with cancer of the cervix because of their immunity has been affected by the HIV. So even in other cases, there are other environmental factors which can be causing that increase we see currently. Of course, one of the factors which contributes is poor feeding. If people don't feed well, when we talk of feeding well, we mean a balanced diet. We don't mean feeding a lot of food at one point in time or one type of food. Although the way we behave, people used to walk long distances, people used to be active, but these people are not active. They move in cars all day. So that sedentary life of just sitting down also has a contribution, because if you look at the motility in the body is less. So it might be contributing to more cancer. So let's do exercises, let's eat well, let's avoid other toxins which are included in the food and other items. No specific food really to say that you should avoid this food, but what we are trying to say, avoid contaminating environment. If you avoid the contamination environment, because if you eat contaminants, they go in the body and they might accumulate in our cells. Eventually they cause changes in the cells and eventually develop into cancers. So just a matter of fact that let's keep our environment clean, let's avoid contaminating our environment and food. Maybe it can also help us to reduce such cases.
The Uganda Cancer Institute is now equipped with 1 cancer machine, 6 more are expected soon, and it has professional and experienced employees.
There shouldn't be any fear. Certainly the people who work on these machines, they are all well trained. We all have experiences of more than 10, 20 years. We have been using such machines for a while, so we know them. Certainly radiation has many side effects, but it's like electricity. Electricity has many advantages, and if you don't use it well, it is fatal. Similarly to radiation, it has to be well controlled, and these machines are able to control radiation very well. So to the public, they shouldn't get afraid of any problem. The machines are extremely safe. We have 3 radiotherapy technicians. They are in Zambia on training. We have an oncologist who is in South Africa for training, and we have another medical physicist. So all in all, we have about 8 people who are on training to beef up the capacity of staff at the Uganda Cancer Institute in radiotherapy only. But there are several other trainings in other areas.
The fight against cancer is on for you and I. Do not allow to be caught by surprise. Live a healthy lifestyle, and if you have any suspicions, test in time.